How should government respond to the opioid epidemic?
I guess informing people, because it's happening. And if they're informing people, they can handle with those situations better.
It comes to regulating the medical community, not the governments or the people who are using it illegally. It's making sure that excess of this product isn't ending up on the streets. It's not the fault of the people that are using it. It's the fault of the people that regulate it.
They should have more treatment facilities. Maybe treat people like humans instead of like animals locked up in a cage. And I mean, if you look at somebody with an addiction, it's a choice that they made. This is a disease that they're going through, and if they want to get off it, they can get off it, but they need help. And a lot of people won't help people like that because they think they're just a lost cause, you know, and it's not right. We need more facilities. We need more money for like programs to help people get off the streets, get back into school, get jobs, get off drugs, various other things, you know. That we need a lot more of that stuff for sure.
Ban them. I mean, that's the easiest way.
Yeah, that's the biggest topic.
I think that they should have experts weigh in, and whatever they say, the government should follow.
Supplying what's needing, supply the training, and like I said, maybe they should be looking into the doctors. Maybe it should fall on them. You know, they should be the ones responsible.
Put more money into it for helping people out, and you know, these people are sick people. You got to help them when you can.
Legalization would be definitely a good start. Safe injection houses should be expanded at the very least.
More awareness for one, I guess, that, you know, to be aware about it and to actually seek help, get people to come out and recognize that they need help.
I think this is a responsibility for everyone, but the government, if they just do some campaigns on it and they just try to enhance this.
Multi-pronged approach from reducing the supply of drugs that's coming into Canada, reducing the demand for the drugs in Canada, but also offering treatment to the people who are using drugs. There are various replacement strategies to use drugs that are safer than other drugs, than street drugs.
Well, they should be letting everyone know.
I think decriminalizing drugs would be the first step, and then looking into getting people help that need it through other avenues.
They should make sure that the doctors doesn't prescribe too much opioids.
Well, I think they need to legalize use, because making it illegal is not a solution. It actually increases use, so if we do that, then that's not helpful. I believe that we need more safe injection sites. And I believe as well that we need to really look at what kind of opiates are on the street. I haven't heard enough about where this fentanyl is coming from and where carfentanil is also coming from. And I feel like we need to answer those questions as well.
That's specifically actually what my husband does in his line of work. He's a physician. And so what we're trying to do in our community, for example, is to create those opportunities for people to, they're going to do it anyways. So the people that are currently experimenting and then becoming addicted to opioids, they're going to do it anyways, and a lot of times we've been turning a blind eye as a community to that, and I believe what we need to do is just accept that that's going to happen and create an environment that's safe, like safe injection sites, but not just a place where they can just go and inject, a place where they can go and receive the help and the counseling that they require. In order to do that, there's such a shame base associated with these addictions that I believe that we really need to be able to create an atmosphere of non-judgment, a place where they can feel safe to safely inject, and that sometimes, like they're doing in Vancouver in certain areas, is that we actually provide them with a drug that's safe, because with the carfentanil and all the other mixed opioids, if you will, out there, it's creating a huge burden not just to the patients and their families, but to our system as a whole in healthcare. So I think it's a huge question, and there's a huge answer that's associated with it, and it's certainly something that we can't do within isolation.